So working at Signallamp is a little bit different than any job I've had before. So if you're familiar with like the hospital, I did ICU, LTAC, worked in clinics before, worked home care and hospice. So Signallamp is totally different than that because at those jobs, you've got, you're kind of overwhelmed. Like there's so much to do at a time and you're on their schedule. So the hospital, you're working whatever schedule they throw at you and whatever the hospital needs. Home care and hospice, you're doing your own case management. You're, taking phone calls, on call, covering those types of things. At Signallamp, what you really do is, it's all remote. So you just work from home and do it all over your computer. What I do in a typical day is I will make phone calls to patients, and how I do that is, that certain people are scheduled to call, certain days. And you can do that based off clinical judgment, like do they have an appointment, what their needs are basically. If you've been a nurse for a long time, it's kind of easy to know when do I need to reach out to someone, who's high risk for different things. And then also getting phone calls from patients. So there are people who call in when they have a problem, if they need help with something, to get triage over the phone, those types of things. And there are also people that are only inbound. So they will only call in if they have a problem. And so usually in that scenario, like it's a big problem when they, feel like they want to call and talk to a nurse and they're at that point. Some nice things about Signallamp is, you've got to be confident. So you've got to be able to have some type of clinical knowledge and background that you feel confident giving people some type of direction, advice, recommendations over the phone, building that rapport with them in a, over the phone and not in person is a little bit more challenging, but it can be done and it does happen. One thing I was worried about coming to this job is if I don't see the patient in person, how's it going to be just, I don't want to cold call people or have an issue like that, but they do build relationships with you. They do start, asking you how your weekend is, asking you about different things, sharing things with you about their lives. And the nice thing is also that when you have that confidence, and you can give people advice and direction over the phone. And that way you've also got a team. So each clinic's a little bit different. Each provider's a little bit different, as we know as nurses. And so you've got your team lead at Signallamp that you can always turn to and you can ask, hey, I've got this scenario going on. I'm not sure how it would look like at this practice, or I've got this issue and, just needing to get help connecting the dots to figure out how to get it figured out with the provider and with this clinic. And the leads are very familiar. Like your lead that's assigned to you is very familiar with the clinic, and they will know, okay, if this clinic or this is something that we can do to help get this person the help they need or get this nurse the help they need. And so you're never just alone. I prefer, just being able to work from home. They offer flex time. And so if you need to take your kids to school, if you need to have an appointment during the week, you can take a little bit of time off and either use your PTO or you can do flex time. So you can take that time off, make it up other days if you don't have PTO or don't want to use your PTO. And so it's really ideal for the nurse that has experience, is really confident, but also, really wants a work-life balance that other places just really don't offer.